Cancer Council and VACCHO were already in discussions about how they might support Aboriginal people on their journey with cancer.
As an organisation, VACCHO as an organisation didn't work in this space.
At that stage, we were really lucky to come across a grant from Cancer Australia that was particularly to look at supportive care needs, and we decided to put in for that grant.
We supported Cancer Council Victoria to put in a proposal to start running support groups, these yarning circles with Aboriginal Victorians who've gone down that road. And they were successful.
That was a really important step in this project, having a yarn, because it enabled us to employ an Aboriginal project manager to be able to just have the time to actually go out and talk to community and listen and find out what they wanted and really drive the project.
They have all the expertise, they have a lot of resources at their fingertips to assist us. And to assist the Victorian Aboriginal community. They have access to data collecting. They have a lot of expertise that we don't have.
Cancer Council brings a wealth of knowledge and expertise around cancer itself, around treatment, up-to-date research, and also a range of programs and supports that are available to people with cancer.
A lot of our people tend to, I don't want to know, what I don't know don't hurt me attitude. Because that data showed that our people, Aboriginal Victorians, are presenting to the system, to the health system, with cancer at very late stages. So the treatment options are limited.
I don't think that we could have got the engagement with community without having an Aboriginal project manager.
I don't know everything, and the next person next to me doesn't know about the Aboriginal community, but we work together.
VACCHO has, I believe, a great rapport with the rest of the Aboriginal organisations in Victoria, throughout Victoria. So assisting the Cancer Council access to the Victorian communities, I think, is a great asset that we provide to the project.
What they're doing now is working with Aboriginal organisations and finding out who the Aboriginal workers are within those organisations or other areas, and getting some feedback so that they're not going out alone.
The partnership itself strongly recognises that Aboriginal health issues are best addressed by Aboriginal people themselves. And so the partnership allows us to work together to try and improve outcomes that I don't think we could have achieved individually as organisations.
One of the best things you can do is to understand the network and to be able to refer clients, refer members of your group to those services if they want to, but give them the information.
One of the things that we've done within our training is we do like a cultural exchange, is that yes, I'm working with getting the Aboriginal health workers trained up in the different cancer services, whether or not it's radiation, oncology, palliative care, breast screen. But we're also looking at those workers within those services tapping into our Aboriginal organisations and health services as well. So, because they're interested in hearing, what do they do? How can we help them? And vice versa. So to us, it's a good cultural exchange.
It's really important that we create, as a group, the pathway, the safety pathway. And that's about, how do you want this group to be? What are some of the things about respect, confidentiality, privacy, all of those things that make up a group that keeps the group safe. And the ownership of that needs to be by those people within the group. So that's empowerment, I think.
Sometimes it's really hard to get a group off the ground because they either want to be interested in it because they're going through it or whatever, or they lose the interest because you're not doing what they want. So we've got so many different people out there with all different ideas, and it's just actually ciphering through it to bring it together.
It was interesting to sort of put it out there and say, it's a cancer support group. Do we say cancer? Do we just say it's a support group? Do we leave it open? So we sort of spoke about all those things, whether or not You know, do we invite men? Is it for kids? Is it for just women? Is it for women that have just had breast cancer?
We've got to look after our own people because too many of our people are dying with such the terrible word as cancer, and we don't know that much about it. But the last 12 months, 2 years, we've got to know a lot about cancer. And that's why this is important now that we have this support group amongst our Aboriginal people.
You can be there for so many people and you can share in their journey, but you cannot walk out the door without carrying some of that. So really important for people that are doing the facilitating or being part of a group to make sure that you look after yourself too.
Cancer Council also has a long history starting up and supporting cancer support groups. We conduct training for leaders of support groups.
So doing some training, it's a benefit to them because it's educating them. And then we're hoping then that they can carry that on.
I've really enjoyed it all today, listening to the other women that have come from, the rural setting. A lot of people presume that if you live in the city and you're accessing services in the city, that you are actually accessing services, but that's not always true. We know a lot of Kooris that are in the city that don't access any services. So people fall through the gaps, and that's even with once diagnosed that they can fall through the gaps.
Well, I'm going to take them back all the information I've got, plus a lot of things I've written down myself that I thought was very important. So I will go home now, get the group back together again and give them a rundown on what I learned here over the last few hours, and hopefully we can grow from there.
It was good because something that someone asked me a couple of weeks ago, it was actually brought up in the session today, so now I can go back and say, oh yes, they do have a network for that.
It'd be good to go back home and bring it out to the group there. So
we did touch on that you could open up to everyone, and then especially in our culture, you can then have an Aboriginal health worker male take the men from the group and talk about what business they need to talk about, and the same with the women, and then you come back together again. So, apparently they're already doing some of that stuff, which was interesting to hear, because I'd like to see that develop more in our community and giving men the opportunity to, discuss support groups too.
It's very important for us to be able to have the training that's needed for us to be able to advocate and support our people in the community, through their journey of if they got cancer or any other chronic disease. It's very important for us to have that training, to be on the same level, I suppose, as non-Indigenous people, because some services, they don't acknowledge Aboriginal health workers.
It's great to have that support group, just to know that, someone else is out there and they're happy to, whether it's just sitting over a cuppa, having a yarn, you don't have to be saying much at all, just listening.
Like the white people are giving it to us and they're saying, here it is here. So we've got to grab it and we've got to learn about it to help our Aboriginal people, because too many, even young ones today, are just dying, and we don't want that. We want to try to prevent that if we can. And I'm a great person of support, no matter what sickness is. If I can get in there and help, I will get in there and help them, So yeah, that's what it's all about.
We need to get that message through to our people, and that's that raising awareness within the Victorian Aboriginal community about cancer itself.
The added value is two organisations with quite specialist knowledge really coming together and working together in a way that really has that potential to hopefully improve outcomes for Aboriginal people with cancer.